Hi, my name is Darcy Morgan. Today I'm going to be presenting a topic near and dear to my heart about forced medical evacuations of Indigenous women in pregnancy and in childbirth for my Indigenous 101 group presentation. So a quick disclaimer about me. The first thing to do in any sort of introduction where I'm forced to present is I do have to give a quick pardon my epilepsy. I have dozens of seizures a day. Yes, you heard that right, folks, dozens. I'm not responsible for what my eyes do specifically, any sort of weird body language that I exhibit, or any pauses that I generate. I got very lucky in the genetic lottery that if I think too hard, yes, you heard that right, think too hard, or have any sort of strong emotion, it causes a seizure, which is super great at parties to say I seize from thinking too hard. I have 4 children aged 10 and under, which were all delivered via midwife supervision. I do have a background in insurance and law. Love to read policy, love to read the nitty-gritty things that no one's really interested in. I am pursuing my degree through University of Regina in health studies, where hopefully I can use some of my experience in contract law to better the health world. And then in terms of Indigenous health, I am particularly interested in family issues as well as non-insured health benefits because, my goodness, it is just a disaster and a half for Indigenous folks to have to navigate that system. Over-medicalization in Indigenous birth. So, in 1876, the Indigenous Act passed. This was the beginning of traditional medicine and midwifery losing all legal recognition as the government of Canada had more oversight, just general control over what is and is not allowed in day-to-day life of Indigenous people. It was the legal foundation for later medical takeover that is created that we do see today in 2025. So when I think about colonialism and I think about birth and pregnancy as I'm discussing today, I like to think about colonialism as a timeline, but instead of going backwards like you would typically see, colonialism that Indigenous people experience in health went backwards. First, colonialism affected the adult with land rights, with the Indigenous Act, and then they worked backwards. Then they worked into children and teenagers with residential schools and the horrors that they exhibited. And once that was done, the government, whether consciously or unconsciously, said, we got to keep working backwards. We got to take away the birthrights of Indigenous people. So while Indigenous people and First Nations and Inuit giving birth in their communities with traditional healers, with traditional birth keepers, is not illegal in itself. Colonialism has gotten more sophisticated. It's gotten a lot more sneaky in the way that it's done. So what we see now is giving birth in Indigenous communities being illegal in sneaky ways. So we see that in a few different ways, but I picked out 3 specific ways through the criminal code. First is Section 215, duty to provide the necessaries of life. So as a mother, you have a duty to provide the necessaries of life. You have a responsibility to provide the utmost care. And this is what stops most, if not all, Indigenous mothers from giving birth in their own communities, is because should anything go wrong, which birth is unpredictable on the best of days, an Indigenous woman could be charged with duty to provide the necessaries of life under the criminal code. So it's funny. So we say in 2025, Indigenous people have a choice. Like, it's not, we don't see the effects of colonialism anymore. However, that's just not true, because what Indigenous mothers or expectant mothers are experiencing is a choice with a gun to their head, which we all know that coercion isn't really a true choice. We also see just Indigenous traditional birth being further criminalized in Section 217, duty when undertaking an act. So this specifically does not go to the mother, but this goes to the Indigenous healer or birth giver. So what this would mean is you are not allowed to act as a midwife or assume the role as a midwife unless you have completed the schoolings and have the legal obligations. There's no, and this is where I have a lot of feelings, there's no exception. Indigenous people weren't considered when it comes to the creation of 217. So you can't even act as a midwife. You can have an auntie, you can have an elder, you can have a grandmother, women in your community present at your birth, as is done in traditional Indigenous births. However, the second someone were to give you any sort of instructions, you should lay on your back, you should sit up, you should pull on a rope so that you create more counter pressure, they're assuming a duty of undertaking the role of a midwife, which creates the criminality that we see in Canada. And then, of course, it goes down the pipeline to criminal negligence if harm or death occurs, which is one of the big scary charges. So the before birth implications. So as we know birth to be today, what happens to Indigenous women is that women who live in remote, rural, or northern Indigenous communities are evacuated for childbirth, regardless of the risks level in pregnancy, whether between 36 or 38 weeks. Now, I don't know about you, but I have met many pregnant women who are still walking around doing their day-to-day thing at 36, 37, even 40 weeks pregnant. You are still able to do things. You are still able to care for your family. You are still able to do your occupation in a lot of cases. But what's happening is these women are being removed from their communities and they're going to hospitals. They have to go through NIHB claims and they sit in a hospital and they just wait for weeks to give birth. And it's funny because especially in a post-COVID-19 age, we see so many people that are so empathetic to people in isolation. We say, my goodness, like 2 weeks in isolation, that was terrible. I had to quarantine upon re-entering the country, and situations like that. But that's never translated onto kindness and empathy and an understanding of these Indigenous women who are being forced to sit in a hotel room, potentially thousands of kilometers away from their support system, and just wait until they give birth. And you know what? It's funny. There's not a lot of statistics around the medical implications of this, but it's very safe to assume that this is not beneficial for the mother's health. She is not starting motherhood in a happy, healthy, excited way. You can't nest, you can't be excited when you're away from your family and seeing your children through a screen. Like that's your children, your the father to be, your family, your community. And we know community is extremely important to Indigenous people, but we're robbing that of them simply for the ailment of pregnancy. It's not ethical by any means. I would really love to have been a fly on the wall of the ethics board that first approved this procedure of medical evacuations. And it's funny because so in this course, for example, under the subsection of children and family, there's only about half a page that covers Indigenous birth evacuations. And it's kind of wild to me because it's just such an egregious act. Like, it's just such an inhumane, demoralizing thing that we're doing, where we're treating these Indigenous pregnant women as less than. And one of the things that's interesting is, like, yes, we talk about the sadness, and yes, we talk about the mental health implications, but one of the things that really gets me is we're not talking about the physical risks to mom and baby during this period. So the lack of exercise leads to musculoskeletal deconditioning. When research after research has shown that women who are pregnant, you should be exercising, you should be preparing yourself for birth, because birth is a marathon. Birth is one of the biggest, most strenuously physical things you will ever undertake in your life. But that's being interrupted, and it's fair to assume that there's a loss of musculoskeletal health, as well as the interruption of diet. Women aren't able to eat as you do. When someone goes on vacation, they're not eating their best. They're not eating their normal diet. Most people who've gone on vacation usually come home and they say, my goodness, I'm so ready to have my home food again. I'm really ready to have my normal diet again. It's fair to assume that when you're eating hotel food and you're away from home and you're uncomfortable and you're stressed and you're not with your family, that there would be an interruption with diet. And then just the general mental distress does not support a woman appropriately for labor. the Indigenous women who are being evacuated for birth, they are not entering motherhood in the most ethical, supported, loved way that they should be. So this is when it gets really, the whole situation is just horrendous. But now we're going to talk about the risks of hospital birth to an Indigenous woman. So first off, it can be assumed that a woman who is giving birth, who has been evacuated from her home, who is under the stresses that day-to-day Indigenous women are put under, are going to experience longer, more painful labors with more medical interventions that are done by Western medicine, not done by Indigenous healers. You know, they're not receiving willow bark, they're receiving Pitocin, they're receiving epidurals, they're not receiving things. And then when you think about hospitals in general, the way that hospital birth is completed, it's a very colonial system. You know, the woman is sitting on her back, but we know through grade two science that gravity goes down. So when you're asking a woman to give birth going down, well, that's not conducive to the baby coming out. That's not conducive to a happy, healthy labor. The gravity goes down, so it's creating a not counter pressure, but the word is escaping me. The baby's not going to come out as easily. Whereas in traditional Indigenous birth, women are supposed to be surrounded by their communities and their aunties and their elders and all sorts of women. It's a community event. There's a new baby being brought to the community. It's not a medical event. Birth can sometimes be a medical event under high-risk circumstances, but those are few and far between. Traditionally, what's supposed to happen is there's supposed to be community helping you get into different positions, helping you stand up, helping you squat, helping you get on all forearms. One of my favorite things about Indigenous birth is when ladies will choose to have ropes hanging from the ceiling, because the woman who's birthing will grab onto the ropes and it creates a counter pressure. So not only do you feel when you're birthing, there's something that I can do. It's not just my body in charge. My mind is in charge too. I can do something that's going to help me. But also when you're pulling on the rope, creating the counter pressure, it's opening the pelvis naturally and it's going to allow the baby to come out easier. By having a woman give birth in a hospital on her back through colonial medicine, she's going to have more intervention. She's going to have a longer painful labor because babies don't come this way. Babies don't come this way. Babies follow gravity, and that's not the way that the colonial medical system is. The other thing to touch on really quickly is birth alerts. So birth alerts are very common in Canadian hospital. Birth alerts are typically issued by welfare workers without prior knowledge or consent of the expected parents. So birth alert is what it sounds like when social workers are alerted that there is an Indigenous woman who's giving birth. And then that baby can and typically is apprehended within 24 hours of the mother giving birth. And sometimes the woman doesn't even know that a birth alert has been issued for her. So she could potentially be sitting in that hospital room for weeks on end, not knowing if she's even going to walk out with her baby or not. Like, it's a horrendous, horrendous situation. So in Canada, Indigenous children account for 7.7% of total children populated 14 and under in 2021, but 53.8% of foster children in that age group in 2021 are Indigenous. And this is straight from the class. This isn't a statistic that's not backed up. This is straight from the class. But what I find the most egregious about the situation is that Canada does not publish data about how many children are removed within 24 hours of birth or any age-related data of removal. It was fascinating because in these classes that Westerners like myself take, we sit here and we say, oh my goodness, like, how could the 60 scoop ever happen? Like, that would never happen today. That would never fly. But the 60 scoop does still happen. It just happens in a different way. It's just more sneaky. It's just more bureaucracy and more paperwork. It's just hidden from the public. It's just hidden under statistics that aren't released to the public because the public would riot. But so that is one of the massive concerns, as well as the painful, laborious labor. Furthermore, forced and coerced sterilizations of Indigenous women are still taking place, and they're routinely in the Canadian news cycle. It's routine in the Canadian news cycle that you see a lady who was coerced by a nurse who is someone in the position of authority when she's away from her family and she's vulnerable, to get sterilization, to get her tubes tied, to take action of permanent birth control, which again is interesting because we know in Canada there are certain criteria to be met in order for a contract to be considered legally binding. But by asking an Indigenous woman to participate in a medical contract of sterilization, it doesn't meet the criteria. But we're still routinely asking these women by doctors or nurses or medical professionals, you already have 6 children at home. Like, do you really think that you should walk away here without getting your tubes tied? It's not fair and it's unethical, and it doesn't even meet the criteria for a legally binding contract. But when the sterilization is done, it's done. They're very, very difficult to reverse, especially for a woman when they're so invasive. So I am taking up too much time, so I'm going to try to rapid fire through this. I just feel very strongly about this subject. So with post-birth implications, there's 4 typical outcomes. Well, there are 4 outcomes of childbirth, but the four outcomes are mom's healthy, mom has complications, baby's healthy, baby has complications. I think of things as graphs, so I thought it would be best to put this in a quick little graph. The main point to take away from this is that the main point that I want to explain from this is that in 2022, 33.9% of all deliveries in Canada were via C-section. So again, I don't know who's watching this, but I do know that after having a C-section, a lady is not supposed to lift anything, travel. There's a lot of rules around C-sections because it's invasive abdominal surgery. But again, Indigenous women aren't granted these same rights and freedoms. So what happens with Indigenous women is, okay, you have to fly, you have to travel. Some of the communities are very remote, and it takes quite a long journey to get back home with that baby that you're lifting, with the car seat, with all of your luggage. It's not an easy feat. You don't have an assistant helping you. You don't have your partner. You don't have your family. You're asking these people, like these women who have given birth, who need to travel back home with their healthy baby, whether mom's been medically discharged or not, to risk infection, to risk their incision tearing, and these are massive complications that could bring them again back. This whole thing could be avoided, or at least if we were introducing more Indigenous birth keepers back as it should be, the women risking reinfection and risking all of these side effects from their C-section could be lowered. Further, the other thing that I just want to touch on is, again, like colonialism it's just gotten more tricky. It's just changed. Colonialism hasn't changed. It's just like colonialism is still there. It's just disguised. It's just wearing a different hat. So what's happening now is it's just a lot of bureaucracy and a lot of paperwork and a lot. So for example, one of the birth outcomes that I discussed was if baby's healthy, but if mom has complications from birth, what if mom has preeclampsia? What if mom hemorrhages during childbirth? These things are regular complications that do occur that are not predictable. Then child welfare needs to be investigated, and child welfare needs to look into the family, and now you have a paper trail. And a lot of these families, they cannot have someone come all the way from their communities to where mom is to take the baby and then bring the baby back home. And then from there, you're also interrupting breastfeeding and you're separating mother and child. And it just snowballs. It just snowballs into so many ways that we set up Indigenous mothers for failure from day one. The other point that I want to make, actually, that I failed to make earlier, is that these records and the way that Indigenous women behave in hospitals could be used against them at a later date. So Indigenous women know this. They're not stupid. They know this. They could be used in CFS cases. They could be used in the future. She was argumentative with staff during childbirth. She is disrespectful. She doesn't listen to the rules, and that could be used against her in the future. So just wrapping this up, because I've already spoken too much, but again, I just feel very passionately about this topic and about how forced evacuations and childbirth need to end. They need to be a thing of the past. The number one thing is that, again, just little old me, I believe Indigenous women should have the bodily autonomy to decide their pregnancy and birthing practices for themselves without fear of consequences. We should be recognizing Indigenous birth keepers. We should be letting women give birth in their communities. Absolutely. There are high-risk pregnancies where medical intervention is absolutely necessary. And thank heavens we have the doctors for them. Thank heavens we have the medical staff that we do. However, that is not the case. We don't need blanket evacuations for low-risk births when we could be keeping women safe in their communities. If a loved one does become blessed with a pregnancy, I think just on an individual level, I think that it's important to let people know that there is access to midwives. Midwives, in my experience, have been wonderful advocates. They advocate wonderfully for their patients. They advocate wonderfully for more marginalized communities or less outspoken communities. I've seen a lot of midwives speak about Amish women, for example, and it's really interesting watching women just come together as a whole, and midwives tend to be very good advocates for that, as well as, of course, Indigenous women's rights. Unfortunately, because where demand goes, that's where funding goes. By increasing the use of midwives, that's where funding will follow. And support the work of the National Council of Indigenous Midwives, who are leading the charge for in-community Indigenous midwife services and forcing birth evacuations. It's funny. So the only video on forced birth evacuations was 2 minutes long in this course, but it was created by the National Council of Indigenous Midwives, and midwives are the women we don't deserve. And just for whoever is watching this, I think one of the biggest things that could be taken away that I could ask just as a mother and as a person who cares is stop saying the term a healthy baby is all that matters. A healthy baby is wonderful. A healthy baby is absolutely so important. But the statement harms families as a whole. We need to be looking at the mother's journey. It's not just that you got there. It's not just that you got a healthy baby at the end, but how did it happen? Birth is such a huge event in a woman's life, and it can be such a wonderful, beautiful experience, or it can be so terrible that it's actually recognized as a subclass of PTSD. So we need to be acknowledging the woman and the experience and the journey of becoming a mother, not just, well, you got a healthy baby out of it, why are you complaining? Thank you, and I'm so sorry that I went on. I really, really feel passionate about the subject. I care deeply about mothers. I care deeply about birth. I care deeply about midwifery, and I'm so excited that I got to write this. Here are all my references, and have a wonderful day.